Welcome back to Wealth Watch. I'm your host, Peter Stahl. Our topic today is Medicare, the federal health insurance program that most Americans utilize during retirement. During your working years, health insurance is often provided by your employer. In retirement, this changes when most of us will enroll in Medicare. You may also have medical insurance coverage that supplements Medicare. For example, if you work for a company that provides retiree health insurance, that insurance will work in conjunction with your Medicare coverage. Military retirees will have health insurance coverage called TRICARE, which can be supplemented by Medicare coverage. And some retired federal employees will coordinate their federal employee health benefits with Medicare. So most likely, Medicare will be your primary, secondary, or even the sole source of health insurance during your retirement. You may wonder what Medicare coverage looks like. Basically, there are two primary coverage plans. The first is known as Original Medicare. It's comprised of Parts A and B. Part A covers your hospital care, skilled care, which might be a few weeks in a rehab center following surgery, and hospice care, which is care needed in the final days or weeks of life. Part B, known as doctor and outpatient coverage, covers two types of services: medically necessary services like lab tests, surgeries, and doctor visits needed to diagnose or treat medical conditions. And Part B covers health care to prevent illnesses like the flu or detect illnesses at an early stage. Many of us will supplement Part A and Part B coverage with a Medigap policy, known as Medicare Supplement Insurance Policy, which is offered by private insurance companies. The Medigap policy pays for some of the deductibles, co-payments, and co-insurance associated with Parts A and B. In addition to supplementing Medicare plans A and B with a Medigap policy, many people will also purchase Medicare Part D for prescription drug coverage. You can purchase Part D from a private insurance company, and it carries its own deductibles and co-payments. Plan D has a list of medications called a formulary, which tells you which medications and how much of their costs are covered. This is a lot of information to absorb, so let's take a moment to review. Most of us will obtain our Medicare coverage in one of two ways. I've just described the first method, called Original Medicare, with Parts A and B, with added coverage from a Medigap policy, as well as Part D for prescription drugs. The second method, known as Medicare Advantage Plan, will be discussed in my next Wealth Watch video. We'll also look at the costs associated with these various healthcare coverages and key financial planning considerations in future Wealth Watch videos. Thanks for watching.